Good morning again. Sorry about the technical glitch. Just happened on the last broadcast and streaming. Anyway, this is Dr. Zixin Wang from Eastern Wellness Acupuncture and Functional Medicine. I am your practitioner of Chinese medicine and functional medicine in Lakewood, Colorado. Today, I want to talk about cancer-related fatigue. And why do I want to talk about it? Is because they are a lot of time when I'm treating cancer patient, this is actually the most prevalent and most commonly seen side effect or complication from cancer. And this can be due to the medication, the radiation, the chemotherapy that is used, and also the wasting nature of cancer. And because the fatigue, the cancer patient, the cancer related fatigue, that it's very profound and very exhausting. It is not just physical exhaustion. It also includes the mental, the emotional exhaustion, or even cognitivity decline. So that's why it's one of the most bothersome or most common complaint among at cancer supportive care for my patient. And fatigue is, we all experience fatigue at one point in our life, but the cancer related fatigue, you can think of it as uh, you like a fire that's never burned, or that there's just not enough energy or not enough log, even though there are things that you need to do that needs to be accomplished. Um, and the weakness, the fatigue, the exhaustion, it's like a darkness that casts over someone, and that's very hard to go away. And a lot of time I see this cancer related fatigue it's very lingering, and sometimes right after chemo, right after radiation therapy, that patient can experience that. But also, even without the chemo or radiation, patients still can experience it and feel it for many years, for a very long time after the therapy. It's because the wasting, the inflammatory nature of cancer. And I want to briefly talk about why, how this happened, and from a complementary medicine point of view, like Chinese medicine, functional medicine, and how we can tackle it, what we can do to kind of eliminate or improve the quality of life. Because cancer-related fatigue can be something that is very dragging, that is very debilitating for a patient that is battling with cancer. Even though the cancer might not, might be in remission, but the fatigue can still continue bother the patient. So, because it's not limited, the cancer related fatigue is not limited to just physical, not just the muscle weakness, not just that, after a long, strenuous run and you feel tired, and then you can drink some water, eat some nutritious food, and sleep for long hours, and then you can recover. Cancer related fatigue, CRF, is something that it's very hard to recover from, and the impact is very profound because the debilitation that it brings can actually make the patient not able to function normally, and in a very simple task as taking a shower or making a phone call. And this is what I see clinically when I have this cancer support care for my patient. And what we see, like I just mentioned, what we see in CRF is not just simple weakness or exhaustion in the patient in the physical. The emotional part of things is also something that we support and take a look at and treat. That the fatigue, emotional fatigue, actually you is sometimes manifests as anxiety and depression, and uh, for some people it can be easily taken care of by medication, but there are a lot of times that patients are not responding to the medication very well, and that's which is what I see a lot in a clinical setting in my clinic. And also what also we're seeing that accompany the CRF is also abnormal weight gain or weight loss. And a lot of time it also comes with uh, malnourished. A person can be very malnourished. They can have depressed GI function. That also is, it's commonly seen in cancer-related fatigue. So, what causes it? What causes cancer-related fatigue? Of course, it can be triggered by, or it can be brought on by the treatment, the cancer treatment itself, like chemo and radiation therapy. But also, it has that nature, the inflammation nature that's underlying it. And there are a lot of research found that cancer-related fatigue is tied to the disruption of the hypothalamus pituitary adrenal axle. So that's why your body just cannot have a very optimal metabolism. And also, they are research found that there in the cancer in a patient with cancer that has cancer-related fatigue, they are disruptions. Sometimes we can see disruptions in serotonin uh, pathway or serotonin metabolism pathway. And sometimes we can see the hyperactivity in vagus nerve that can cause the fatigue. But overall, there is that inflammation that lies underneath it. So this is very cancer-related fatigue is very pro-inflammation, and that's also something that I think conventional medicine, although conventional medicine is good at, but there are a lot more that we can do outside of the medication pharmaceutical option. Uh, that is good for patient as well. So, how does Chinese medicine sees cancer-related fatigue or cause it, according to Chinese medicine? So, if I may briefly talk about traditional Chinese medicine, everything, all the function, all the normal function or emotional function, physical and emotional, they are controlled or dominated by qi, what we call qi. You can see as energy, you can see as like a movement that dominates the function in every system of our body. So the fatigue, what causes the fatigue in Chinese medicine is that the lack of qi or lack of energy in a person, and that lack of energy can be contribute or by caused by the cancer itself, because cancer is a wasting disease. Cancer is abnormal activity, abnormal growth of tissue, and that can take over the normal function of our body. And because of lack of qi, our function, the functionality of our body just cannot be optimal, because it was taken over um, by the cancer cell. And on top of that, in lack of qi, or we call qi deficiency, that related to the cancer, for the fatigue in cancer, is that we are not able to metabolize our food. We are not able to get nourishment from our food because of lack of uh, de- decrease or decline metabolization. And by that, just think of it, you're in this at the cellular level, you are not getting enough nutrient, and so that you cannot create enough energy to move around, to think, to react, to feel. So everything is kind of like off, not just off, it's extremely off. And because the most important foundation, or the foundation of TCM, is actually GI, our digestive system. So in Chinese medicine, we see spleen and stomach in Chinese medicine that as a foundation of our health, of our body. And the direct impact of cancer is the direct impact on spleen and stomach. And that spleen stomach also tie into the detoxification. So in Chinese medicine, you can see that it's cancer-related fatigue is a decrease of the qi, and also that tied to metabolism, and also the function of detoxification. So everything is kind of it's decreased and depressed, so that kind of like the sun is clouded by the sun is clouded by the dark cloud, and the dirty particles in the air just cannot be washed off. So with the Chinese medicine, we focus so much on the movement of the energy, the movement of the qi, and also detoxification and the qi, and also the improvement of GI function. What about functional medicine? Functional medicine, when we have a contact with the patient, the functional medicine, we always talk about antecedent, trigger, and mediator. What are they? So antecedent is the cause or the predisposition of this illness. So we can in cancer, in the cause of the cancer possible is that they are just exposed to a toxin, or there's some genetic defect or medication that trigger it, or lack of nourishment that trigger it. So that's the antecedent, and the trigger can be the physical or the chemical trigger, which can be the again medication and toxin, environmental toxin that cause it. So we talk about this quite a lot. I'm sorry, I got a feedback here. So without when we talk when we get in contact with the patient in functional medicine, we always want to take a look at the antecedent, the trigger, and the mediator, and find a way, because illness comes, or the symptom comes from imbalance or disruption. To correct that, we need to go back and say, okay, what caused that? What's the most underlying cause of this, and how we correct it? Because medication has been nowadays been, it has improved the treatment of a lot of illness, but there are still the things that we can do from a more upstream approach of things, like the nutrition, the lifestyle, the sleep pattern, the stress management, the inflammation, the elimination of the inflammation. I think these are all very important. So how does these two medicine filling the gap? What I can say is that Chinese medicine that include the concept of food therapy, acupuncture, and Chinese herbs and movement, they are echoing functional medicine as well. Functional medicine, of course, they see it from a more like from a different angle of a conventional medicine, and I think these two work really well. That's why I practice these two together, and not just the illness. This I To sum it up, it's like traditional Chinese medicine and functional medicine is a patient-centered care. So, in the setting of cancer-related fatigue, what is a patient-centered care for this situation? A patient-centered care is to take a look at what caused the fatigue. Is this the medication, the side effect of medication, the chemotherapy or radiation therapy? And on top of that, and that's usually a lot of time that's what it is. But on top of that, is there any nutritional imbalance that we can address? Is there any sleep pattern, sleep hygiene that we can educate our body and get into a better habit of it? And how about the movement? I know with the fatigue, we probably the patient cannot, doesn't feel like moving too much, or there's certain activity that the patient probably wouldn't want to do. But what about just a very low impact yoga poses, or even a breathing exercise that we can do that can facilitate in detox, and increase our oxygen, and also increase the intracranial blood flow? And all these things, they are non-pharmaceutical way that can help to increase or improve the patient's quality of life. And so I think in the patient-centered care of the Chinese medicine and functional medicine, we are not just looking at the illness, the fatigue itself, but we're also looking at what is surrounding in this patient and how we can change it energetically, physically, and emotionally. So this is just a brief introduction of how Chinese medicine and functional medicine treats uh, cancer-related fatigue. So we will be talking about more of a cancer supportive care regarding Chinese medicine and functional medicine. But what I would like everybody to have a takeaway is that there are more than just the medication out there, especially for cancer-related fatigue. We can incorporate nutrition, we can incorporate exercise, we can incorporate acupuncture, and also Chinese medicine to address that. And but I think there are a lot of time patients do need to have the support to get to that. So anyway, what I would like to do and also like to share with everybody is that we do offer discovery call for a patient that if you know someone or if you're battling with cancer and also suffering from cancer related fatigue, feel free to give us a call. Our number is 720-651-8088, or I will provide a link that you can book your free 15 minutes discovery call with me, and then we can get to talk about our our treatment protocol and your health concern. And then there's just to let you know there are options out there instead of just suffering this alone, because a lot of the research has shown that acupuncture, Chinese medicine, and the nutrition therapy, movement therapy, breathing therapy, they can be helpful for cancer-related fatigue. So you're not alone out there. You're not alone in this journey. The healing journey is in your hands. So all you need to do is just to make the call or book your free discovery call with the link I provided in the chat box. Or you can just private message me and see what just we can chat a little bit and see how we can help. So in the upcoming bi-weekly stream, well, I'll continue to talk about Chinese medicine and functional medicine in cancer support care. We'll talk about the side effect of the cancer medication and how we can do it, how we can deal with that or facilitate the healing with Chinese medicine and functional medicine. So anyway, until next time, just I'll wish everybody a happy new year and a happy rest of the week. Thank you.